Right now on ABC 10 News at 4 o'clock, local hospitals prepare for a potential surge in new patients, how they're gearing up as COVID cases and hospitalizations increase in the county. After housing the homeless and migrant children, the San Diego Convention Center will welcome its first event this weekend. Plus, a new firefighting tool that's the first of its kind in our county, how it will help stop wildfires before they get out of control.
ABC 10 News at 4 starts now.
As COVID cases spike across the county, local hospitals are gearing up for a surge in new patients. Thank you for joining us. I'm Kimberly Hunt. ABC 10 News reporter Jennifer Kastner is live outside Scripps Memorial in Encinitas. And Jennifer, officials there say the ER is full?
Kimberly, that's right. I spoke with the chief medical officer and she said that the surge tents are being used again. And right now the big Arctic style surge tent is going up. You can see the workers back there working on that, putting everything into place. We're told that the ER is packed. It is filled with all sorts of patients, not just COVID patients, possibly people who delayed treatment in the winter or spring because of the pandemic. At all of the hospitals that are part of Scripps Health, providers are now seeing a greater volume of COVID-positive patients.
We are definitely gearing up for what might be increasing cases.
Chief Medical Officer Dr. Ghazala Sharif told ABC 10 News that plans are underway to address the fast surge.
The rise in cases is what's concerning. Right? We can handle the load, but the fact that it's going quicker and quicker, we're up to 84 patients in-house at Scripps. 14 of those are in the intensive care unit. And then we have between a 12 and 17% rate of patients who have been vaccinated who are also being admitted.
The hospitals are bringing back negative pressure rooms to keep air contained and decrease potential spread of infection.
We want to make sure that we get ahead of the game here and just be ready for any patients that do have to use those rooms.
Some of the outdoor tents are being reintroduced and visitor policies are being reconsidered. Non-COVID patients have been allowed limited visitors, but that may change. Then there's the issue of staffing.
Our biggest concern right now, as it is across the region, is staffing. There's a lot of people not only taking time off, but people are tired.
Certain procedures may be limited if staffing continues to be problematic. Surge planning is happening at other local hospitals. Sharp Healthcare wrote in part, Sharp Healthcare is reviewing all aspects of the care continuum, such as airborne isolation capacity, surge capacity, and adequate staffing levels at all its facilities. Officials at Kaiser wrote in part that they're closely monitoring the COVID positivity rate and we have retained expanded capabilities so we can quickly increase treatment space, staff, and supplies to manage smaller, localized hotspots or large surges across our system. Again, you are getting a live look right now at the big overflow tent that is going up right outside of the emergency room here outside of Scripps Encinitas. We also reached out to Palomar Hospital, which had the federal overflow facility. They said all the COVID beds were put back into storage months ago. They were hardly used during the pandemic, and they said that they are far away from any discussions about bringing those beds back. Reporting live tonight from Encinitas, Jennifer Kastner, ABC 10 News.
The war against COVID has changed. That's what the CDC is warning in an internal document from the agency first obtained by the Washington Post. New evidence shows the Delta variant is as contagious as chickenpox, and the variant may pose a greater risk for hospitalization, intensive care treatment, and death than previous variants. Document says vaccines continue to be effective, particularly at preventing severe disease, but when breakthrough infections happen, they may be as transmissible as unvaccinated cases. Now, a Delta case is spreading and more data on safety and efficacy of vaccines emerging. Two leading health organizations are changing their language on pregnant women getting the shots.
We think there's enough data to transition from don't withhold this to we actually recommend that pregnant people get this vaccine.
Northwestern doctor Emily Miller is also on the Society for Maternal Fetal Medicine's COVID-19 task force. She says that the subtle change will remind OBGYNs about the science available and to act with more urgency when it comes to educating and encouraging expecting mothers to get the vaccine. Those conversations between patient and doctor can be some of the most impactful in the vaccine decision process, And they can also prompt other questions to which there is available data, like pregnant women are at an increased risk of severe disease or death from COVID because of changes the body undergoes and the fact the lungs have less physical space during pregnancy. There are no findings that vaccines impact fertility, but they can protect babies.
I think it's really impactful that we see cord blood antibodies to SARS-CoV-2, so protective antibodies that prevent infection passed from the birthing person to their baby. And so I think this really changes the framework from protecting the baby from exposure to vaccination to protecting the baby by vaccination.
Pregnant women were not included in original COVID-19 trials. There are global trials underway right now.
Disney will require employees to be vaccinated against COVID. The company says employees who are not already vaccinated and work on site will have the next 60 days to get vaccinated. Employees working from home will need to show proof of vaccination before returning to work. The mandate applies to Disney's salaried and non-union hourly workers here in the U.S. A new study found some people with breakthrough COVID cases had weeks-long symptoms. Here's an in-depth look at those findings. The Israeli study, published in the New England Journal of Medicine, showed out of nearly 1,500 vaccinated healthcare workers, just 39 or 3% were infected. But of the infected group, nearly 1 in 5 developed symptoms that lasted at least 6 weeks. Their symptoms included headaches, muscle pain, loss of taste and smell, and fatigue. One of the authors of the study called the findings concerning. Dr. Peter Chin Hong said despite the small sample, the research is worrisome because of the type of variant that was studied.
It is concerning, on the other hand, because it is the alpha variant that was primarily studied. Delta may actually have higher viral loads, and that may lead to people having chronic symptoms or long hauler syndrome.
Of the 39 people infected, just 1 had pre-existing conditions. The rest were healthy. But most of the people who got sick had mild symptoms and none was hospitalized. The authors say the results need to be confirmed by additional research involving more patients who are followed for longer. In light of all the news and the changes concerning the coronavirus, we ask San Diegans what they think about the changes and the situation in general. In our Scientific ABC 10 News Union Tribune survey, we ask, should employers have the legal right to require their employees be vaccinated or not? 53% said employers should, 33% said they should not, and 14% were not sure. Less than 2 weeks after welcoming students back to campus, the Sweetwater Union High School District is reporting nearly 4 dozen COVID cases. It says 47 people tested positive out of 47 students and faculty. You can see the breakdown of cases by school on your screen. The district says it has protocols in place that align with CDC, state, and local guidance. You can stay on top of the latest developments in the pandemic with our ABC 10 News mobile app. It's free in the App Store. After more than a year, the San Diego Convention Center is reopening its doors this weekend. The first event is kicking off Sunday. ABC 10 News reporter Nate Holmes explains how the return of conventions will give our local economy a big boost.
San Diego's tourism took a big hit, but they are hoping to rebound with 30 events scheduled from now until the end of the year. Organizers from Comic-Con, one of San Diego's biggest conventions, say they are ready to get inside.
We are more than ready to join the list of the many conventions planned for this year as we prepare to launch Comic-Con Special Edition November 26th, 27th, and 28th. It will be good to be back at our home away from home again.
It was nothing but smiles and cheers as local leaders opened the doors to the San Diego Convention Center Friday morning. It's been more than a year that the building was closed due to the pandemic. 150 events had to be canceled over those months. The city lost about $2 billion in revenue. But the convention center wasn't fully closed to guests. In the early months of 2020, the venue was used to house people living on the streets to keep them safe from the virus. Months later, the convention center became a shelter for more than 3,000 unaccompanied migrant children seeking asylum.
And the convention center also served as a welcoming space, treating everyone that came through these doors with dignity, respect, and the humanity that they deserved.
City leaders thank the staff who worked tirelessly throughout the pandemic to help those in need. As the convention center starts to see more people, leaders say there are still protocols to keep individuals safe. Employees must wear masks regardless of vaccination status. Until October 1st, people attending indoor gatherings of more than 5,000 attendees will need to be fully vaccinated or have a negative COVID test result within 72 hours of the event.
The first event is set for Sunday. It's the Spy Optics and Photonics 2021 event, and they have been working with the San Diego Convention Center for over 3 decades. In downtown, Natay Holmes, ABC 10 News.